There we go. Welcome everyone to the American Association of Biocharacteristics Clinicians. Today we are discussing pelvic blood congestion and syndromes that develop from it with master herbalist Peter Holmes. And we're excited to have Peter here today. Let me give a brief introduction to all that Peter has accomplished, which is really incredible, and very excited to have him here today. And then I'll turn it over to him to present today's topic. So Peter is an English-trained medical herbalist, essential oil therapist, and practitioner of Chinese medicine with over 35 years of experience using herbal and essential oil medicines in clinical practice. His extensive training includes studies with Oriental medicine doctors Ted Kapchuk, Giovanni Machocha, medical herbalist and pharmacist Henri Verdier in Paris, France, medical herbalist Christopher Headley in London, England, and Chinese medicine sinologist Elizabeth Roche-Vallée in Paris, France. Peter brings to his courses and seminars his 35 years of study, clinical practice, and teaching experience with Western herbs, Chinese herbs, and essential oils. He has explored and developed both the physiological and psychological aspects of using essential oils and herbs in treatment. He has specifically pioneered their clinical use within acupuncture and bodywork since 1982. Peter is the author of several acclaimed textbooks on herbal and essential oil medicine, including Aromatica Volumes 1 and 2, The Energetics of Western Herbs, Volume 1 and 2, Jade Remedies, Volume 1 and 2, and the TCM Materia Medica Clinical Reference and Study Guide. All of those textbooks, by the way, are available at his essential oil company, snowlotus.org, which you can check out, has high quality essential oils available. I also wanted to mention that Peter Holmes will be a faculty member in the upcoming herbalist course at Joyful Belly School of Ayurveda. And with that, I'll turn it over to Peter. I want to mention to everyone and remind you all that today's talk will be discussing medical conditions, but that today's talk is not medical advice. To see a properly trained medical physician for specific advice to your individual condition, and also yes, and yeah. So with that, let me turn it over to Peter. Peter, it's great to have you. We're excited that you're here today, and I'm going to turn over the screen sharing to you so that you can share with us any slides that you might have with your presentation.
Okay, great. Thank you, John. What a long introduction. Of course, we need to take care of the disclaimers, right? We can't get around. No, truly, I'm really honored to be here with you all. So, welcome, a very warm welcome to you all. I have no idea what your background is, but I assume you're all practicing herbal medicine of one kind or another. So that's great, because the focus is definitely treatment with herbs. I just want to clarify something before we actually get into discussing pelvic blood congestion, dysmenorrhea, and so on. And that is, I just want to be really clear about my approach to, when I teach. This applies to every single one of my classes, seminars, workshops. So just for transparency's sake, my real love and passion has always been herbal medicine. It's all about the plants and the herbs. But I also, as John said, I also went to study essential oil medicine in France and Paris. I've been very I've been using nutrition and supplementation extensively for at least 20 years. And I'm also fully trained in Chinese medicine. I'm one of these eternal students, I guess you could say. You know, I keep on studying and researching. You know, so I studied Chinese herbal medicine, acupuncture, and I developed a system of treatment called aroma acupoint therapy. Some of you may have heard of that as well. So the point of all this, the point of telling you all this is to tell you that I believe that an integrated approach gives you a truly deeper perspective because we're integrating two different styles of, you know, looking at herbs, looking at disease, illness, symptoms, and so on. So this basic approach I'm now calling functional medicine, even though Chinese medicine is also deeply functional and vitalistic. You know, both of these are vitalistic, functional approaches to illness. And but obviously the style is very different. You know, the language and the style of Chinese medicine, as I'm sure many of you realize, is very, very different. And on that note, I would, unless you're fully trained in Chinese medicine, you know, I would strongly support you in keeping these apart. You know, because and the main reason is linguistic. You know, the Chinese medicine uses terms like liver, spleen, kidney, and what they do not mean the internal organs as we know them, right? The Chinese liver functions, the functions of the Chinese liver have almost nothing to do with the liver organ. You know, most of it has to do actually with the nervous system. You know, the pathology is neurological, you know, liver yang rising, liver qi constraint, and so on. All that is adrenal / neurological pathology. So don't try to mix it unless you're fully trained in both the Western system, in a Western system and a Chinese system. Try to keep them apart. Otherwise, it's very confusing. Again, very confusing. And can be very misleading. So I just tell everyone this. You know, this is. However, in this, having said that, in this workshop, you will see some equivalent Chinese syndromes or patterns. So we're not going to talk about those in Chinese medicine language today. They're just there because simply because I happen to use them for all my lectures, for all my seminars, right? So please.
Oh, Peter, somehow it got muted. If you could, there we go.
Yeah.
Peter, can you hear us?
Yeah, I can hear you.
Okay, great. We can hear you again now.
Anyway, the point is don't worry about anything Chinesey that comes up. Okay, it's this today's seminar, today's class is a standalone. You know, using a classic Western herbal medicine approach. And having said that, my approach is actually rooted in British herbal medicine, which itself, you know, British herbal medicine, which itself is based in actually the medical from this country, right? The Ellingwood, Felter, John King, all these practitioners and writers from the 19th century, and then physiomedical practitioners fed into all of that fed into British herbal medicine, and that's what I inherited, and that's to some extent still what, you know, that's the legacy of the National Institute of Medical Herbalists in England. Speaking of which, there are several fairly well-known practitioners practicing in this country, also from that school, you know, from that tradition, like myself. Okay. You know who they are, you know, mention any names. Okay, so let's get on with this course, pelvic blood congestion. This is one of these preclinical purely functional conditions that is often overlooked, and it's overlooked because it's not a disease, right? It's not a, there's no overt or organic pathology involved. In fact, the main complaint associated with pelvic blood congestion is simply, what's called congestive dysmenorrhea, right? In other words, painful periods of the congestive type, as opposed to spasmodic dysmenorrhea. In other words, this painful periods mainly caused by cramping and spasms. Okay, so it's perfectly fine to think of this course as a course on congestive dysmenorrhea, simply because the main symptoms of pelvic blood congestion, when the blood congests in the pelvis, the main discomfort that's usually experienced, not always, is changes in menstruation, right? This is seen typically in women over 30, occasionally in younger women. It's also we see pelvic blood congestion, aka congestive dysmenorrhea, in women with large hips, because when the pelvis is large, that predisposes constitutionally to fluids, blood and lymphatic fluids tending to stagnate, tending to congest in the pelvic basin. Right? Makes sense, right? But be careful. Clinically, someone can be a thin type, someone can have narrow hips and still have pelvic congestion. So don't be fooled. There's no, there are always exceptions. Okay. It's also seen in older women or women with repeated pregnancies, and sometimes with prolapse, uterine or pelvic floor prolapse. That also is a big physiological source of pelvic blood congestion. So from now on, I'm just going to call it pelvic congestion. That's the usual term. Okay, so let's dive straight into the text that accompanies the text for this for this workshop. This is taken straight out of my larger workshop on gynecological disorders. Okay, and I have to tell you, this is really the basic condition that leads to 101 different gynecological disorders. So it's extremely important. Where are you? I'm looking for my, okay. Hang on just a second. It's loading up. Why is it taking so long? Oh, okay. Okay, sorry about that. Almost there. Okay, here we go. Share screen, quark, okay. Okay, here we go. So we're gonna follow this text from now on. And let's just make it a little larger. Okay, you should be able to see that. Okay, so let's look at the signs and symptoms. I'd like to start with this first because this is what the patient comes in with. So this is so that typical is early, heavy, or prolonged menstrual flow. Okay, the flow tends to be frank or red, possibly with clots, but not necessarily. There aren't always clots. But if the clot's present, this will trigger an increase in muscle spasms, causing pain. So this, in other words, it will the congestion will actually cause spasmodic dysmenorrhea, theoretically. Okay. Pain. So what's typical here is this feeling of weight, pressure, fullness, or dragging before the menstrual flow, right? And even sometimes into the period. Okay. It used to be called bearing down pains. I'm not sure if women still call this nowadays. I have no idea, but this is the classic phrase, right? And it's described, it's in association with herbs that treat this condition as well. So the pains are persistent, dull. They're not sharp pains unless there's blood clots. If the blood clots are present, then the pain will be sharp. Sharp pain means spasm. Dull pain in the pelvis means congestion, blood congestion. So that's a diagnostic differentiation right there. Okay. So the dull mostly in the second half of the cycle, and they tend to be worse towards the end of the day because the blood pools in the veins more. Right. Yeah, we've talked about this. There might be low backache, ovulation pains, pain during intercourse. Hemorrhoids are often present, not always, and they can be external hemorrhoids or internal. Okay. Sometimes you see vaginal discharge, spider veins in the sacral area is sometimes present, so in the sacrum. PMS usually occurs only if there's a hormonal imbalance. And we'll see in a moment how the main hormonal imbalance associated with pelvic congestion is actually estrogen, what I call estrogen accumulation. In other words, excessive retention of toxic estrogen in the body. This is not a good pattern at all, not a good situation at all. This will cause PMS, which can be quite severe, actually. There's also possibly symptoms of venous insufficiency in the legs. So, for example, varicose veins, which is often inherited. There's usually ankle swelling, ankle edema as well. You'll see this in women with standing jobs, like desk clerks, waitresses, you know. So that then she has venous insufficiency, venous congestion, as well as pelvic congestion. So that the combination of those two conditions, congestive conditions, is quite common. But again, they can occur separately as well. You know, someone can have venous insufficiency with bad varicose veins, ankle swelling, and so on, and no real symptoms of pelvic congestion. So it depends on there's different factors involved. Okay. I included the tongue and pulse in case some of you are practicing Chinese diagnosis. I know Chinese diagnosis started becoming more popular about 10, 15 years ago. You know, we saw more and more of these at the AHG conferences. I remember those well. And so the tongue, the color of the tongue tends to be purplish, which relates to the congested or stagnant blood. Okay. More telling, actually, more diagnostically, is the engorged veins under the tongue. Right. You lift your tongue up, you flip it over, and you'll see you will see engorged, enlarged sublingual veins. Right. And again, those will be purple in color. Okay. The pulse is tight or slippery. Okay, these are Chinese pulse pictures. That, you know, this is Chinese technical language. In the Western, there's also a long Western tradition of pulse taking, which does not include these two qualities. It doesn't, these qualities are not, well, tight is to some extent, but certainly not slippery. Anyway, that's whole other discussion. So in functional diagnosis, we call this a damp condition. It's essentially damp because when blood pools in the pelvic basin, how should I put it? Yeah, that accumulation of fluid creates damp. Right? Let's leave it at that. And that accumulation tends to heat as well. Heat tends to be produced. For example, if heat is present, then the pulse will speed up. The pulse will become a little bit rapid, you know, and the more rapid the pulse is, the more of a hot condition we will see, right? That's what heat means. Things are speeding up, things are accelerated. Hypersthenic. The traditional term for heat is actually hypersthenic. Sometimes you could say hypertonic, but hypersthenic, right? Overstimulated is a simple way to put it. Overstimulated, right? Okay. For the record, and for those of you practicing Chinese medicine, the CM is Chinese medicine pattern or syndrome is blood and chi stagnation in the lower voma with development of damp. Very simple. Okay, what about the tissue pathology itself? So, what's happening is insufficient venous circulation in the pelvic basin, right? There's not enough. The venous circulation isn't moving up to the heart sufficiently enough. Now, that can be intrinsic, or it could be caused because the venous circulation is insufficient in the legs, to start with, right? There's also lymphatic stasis causing engorgement or congestion of the pelvic blood vessels. Okay. Now, the uterus itself is usually enlarged and tender and can become inflamed. Okay. The congestion worsens as the day progresses and improves at night. Okay, so late at night it can improve, especially with sleep. Okay. Okay. Let's look at the pathogenesis. So pathogenesis simply means, some people call this etiology, but etiology is such a confusing and misused term, I don't even use it at all. Pathogenesis means what are the conditions that led to pelvic blood congestion? You know, what are the physiological or medical conditions that fed into it in the first place? So a big one is progesterone deficiency, obviously in women. By the way, this pelvic blood congestion is not about just women. You will see this in men as well. And I should add that in men, you will often see, not often, but you'll see a tendency to prostate congestion. More common is hemorrhoids. Okay, in men you'll see mainly hemorrhoids, and sometimes prostate congestion with symptoms such as dribbling urination, painful ending of the urine during the end of urination, and eventually that can lead to hyperplasia. You know, in other words, enlargement of the prostate gland. Okay, so this is the predisposing condition. This is the functional predisposing condition that can lead to prostate hyperplasia in men. just as it can lead to other conditions in women, which we'll look at in a moment. Okay, so just wanted to get that out of the, clear that up, you know. Anyway, back to the pathogenesis. Progesterone deficiency, venous or lymphatic circulatory insufficiency in general, right? This is often hereditary. This could also result as a result. This could occur as a result of a severe long-term infection. You know, the lymphatic stagnation, a severe infection that wasn't properly, especially bacterial, that wasn't handled properly, it wasn't cleaned up properly afterwards. After a severe infection or any bacterial infection, we need to clean up the lymphatic stagnation, clean up all the toxins that the bacteria produce. This is something that's sometimes overlooked. Okay, and that if it is, then that itself can lead to lymphatic toxin overload, right? Swollen glands, and so on. Okay, so blood vessel fragility, that is often constitutional, poor diet, etc. Another biggie in terms of feeding into pelvic congestion is distressed feelings, and especially chronic guilt. I really want to underline this, you know. Do I need to talk more about this? I don't know. Sometimes people just call it guilt and shame, but shame is actually a righteous emotion, you know. It's an appropriate emotion. Guilt, when shame is not fully experienced, then we suffer from guilt very often. Either from negative guilt or from guilty feelings, not a state of being guilty, but feeling guilty, right? Or we feel amoral and what's the word? Sociopathic, so to speak, you know, but like the opposite of feeling guilty. Anyway, guilt feelings are very common, not just in our society, but in Asian societies, in, you know, with a different layers of social status, you know, social strata. So there's social guilt, etc., etc., etc. So it's a big thing. Anyway, this is a strong factor that can lead into pelvic congestion. Now, there's also, we differentiate origins as opposed to pathogenesis. Origins means what is it in the case history? What can we see when we look at the case history that in real life, you know, may have been causes, especially especially triggering causes for this condition. So as I mentioned, large hips, also lack of general and pelvic exercise, Spanx, you know, anything that constricts, any clothing constricts the abdomen is really not good. Spanx, these are all awful. Spanx girdles, 1950s panty girdle syndrome. Some of you may remember that. You know, I used to treat this back when I was still practicing back in London, you know, in the 80s and 90s. It's a deep legacy, you know. Yeah, so nothing that constricts especially the lower abdomen. IUDs that irritate the endometrium and prevent fertilization. You know, again, this congests the pelvis. Failed IVFs, in vitro fertilizations, pelvic surgeries, C-sections, anything invasive like that will create stagnation and congestion in that area. Okay. Dietary-wise, the main culprit is white sugar, you know, along with blood sugar imbalance, overconsumption of white sugar. I actually call it techno sugar. It's not a real sugar at all. It's a designer sugar, right? And it's anyway, that's not a big one. Sexual trauma. overly strict upbringing, poor social status, all causing the guilt feelings that I just mentioned a moment ago. Okay? Sequelae. So these are the conditions that can result from this super important condition, estrogen accumulation syndrome. Okay? So in other words, it moves into the hormonal level. The hormonal level is deeper than the tissue level. With pelvic blood congestion, we're working on the level of tissues, mainly blood, fluids, lymphatics, nervous system, and so on. Right? When we talk about hormones, at the endocrine/hormonal level, this is a deeper, more chronic this condition. So it's more in that sense more long-lasting, more serious, and potentially more serious, and so on. Okay, menorrhagia can be another result. Heavy periods, fibroids, which also uterine fibroids usually the result of a combination of estrogen accumulation and pelvic congestion. Okay, but also cervical dysplasia, endometriosis, PID, inflammatory disease, polyps, ovate cysts, and hyperviscous and thrombotic blood conditions in general. Okay, so let's move on. Associated conditions and syndromes. Now, any condition that we look at has other conditions or syndromes that are associated with it. And so we need to look at these as well. So let's look at these associated conditions with a separate here we go. Conditions associated with pelvic blood congestion. So associated means that we have three other functional or preclinical conditions that are associated in one way or another with the pelvic congestion. Okay, venous blood stagnation, liver/portal vein congestion, and estrogen accumulation. Those are the big three. Now, associated means that these can result from pelvic congestion, or they can also they can be causative. So venous blood stagnation. So, for example, a woman can have inherited varicose veins and venous poor circulation in the legs, through her constitutionally, and that over time, given a poor diet, given lack of pelvic exercise, whatever, then can lead to pelvic congestion. And same with all of these. So all of these go both ways. Liver and portal vein congestion, which we'll see with abdominal obesity, hypochondriac pain, lethargy, malaise, and so on. This can also lead, from, again, alcohol, poor diet, etc., etc. That will lead to pelvic congestion sooner or later. And the same with estrogen accumulation. So one can start with retaining or accumulating estrogen in the second half of the cycle, and especially post, just after throughout the whole cycle, basically, and then that can feed into pelvic congestion. So you have again, you have the Chinese description of the condition, right? but don't worry about it. Liver portal vein congestion is usually called liver damp or liver damp heat. Okay, and with estrogen accumulation, it actually gets more complicated. I'm not going to spell this out. It's here if you want to take a photo, take a screenshot, whatever, But anyway, but what's interesting right now is that these two you'll often see these two associated. Less commonly, you will see these others. So venous blood stagnation and pelvic congestion are the most common associations, right? So with poor blood circulation in the legs, you'll see feeling of heaviness in the legs, ankle swelling, varicose veins, and so on. Okay. With estrogen accumulation, you'll see long periods. That's the key symptoms. Periods can last up to 14 days. In fact, long period. Cramps as well that last into the flow. The cramps usually start before the onset and go into the onset of the flow. Sensitive breasts, anxiety, tension, lots of mental and emotional symptoms. Mood swings, sweet cravings, irritability, and so on. So these are so in other words, if we have a client come in with any of these, any two or even three of these, and that's entirely possible. You might see pelvic congestion, venous stagnation, and accumulated estrogen. Then you need to, at some point, you need to address all three conditions. They all need treatment. And then you need to simply prioritize, right? It's a question of what comes first, and unpeeling the layers of the onion, so to speak. Okay. Okay, going back to our text here. Okay, so treatment. How do we? So we need to devise a basic, before we start talking about herbs or anything else. It's really important to be clear about our treatment approach. In Chinese medicine, this is often called treatment strategy, right? That's actually a literal translation from some Chinese textbooks. We need to be clear about how we're going to be approaching, intending to, what's our intention, treatment intention here. Don't overlook this. So it's relatively simple. We decongest the pelvis and uterus by promoting blood and lymph circulation. So that's our basic task, right? The Chinese way of stating the same thing would be to say we invigorate the blood and the qi in the lower warmer, reduce congestion, and resolve damp. In fact, most Chinese textbooks would simply say, they would skip this part. They would simply say, invigorate blood and qi in the lower warmer. End of discussion. They tend to make things really short. I prefer to spell it out, so whatever. Okay. So having said that, we look at I'm wondering if we should, I think we can. I want to interject another diagram that I think many of you will find really, really interesting. Or you may even be using something similar already. And that's a diagram that has to do with diagnosis. Diagnosis is extremely important. And I just want to Yeah, I just want to interject this because it will, I think many of you will find this helpful. So I may be going out on a limb for some of you, I'm not sure, but I'm going to take a chance. So please indulge me if this is, way beyond your interest. If you're not interested in this, this won't take long. But this is called the 6 conditions of functional pathology. So it's making a diagnostic evaluation of a patient's condition or terrain, right? So very briefly, we have conditions of tension. We can see a tense condition, also called constraint in Chinese medicine, constraint, as opposed to weakness, okay? Now, this is a hypertonic condition. In traditional Western herbal medicine, this is called hypertonic or hypertonia. Just as a weak condition is hypotonic or atonic. So this is still taught in massage schools. Okay, we talk about muscles and tissues being either hypertonic or hypotonic, right? Too tense or too weak. But this is eclectic doctors talked about this a lot. Okay, so then we have in terms of the warmth system, we have hot versus cold, heat versus cold, right? A hyposthenic condition, as I mentioned earlier, versus a hyposthenic condition. And then in terms of the fluids, dryness versus damp or congestion. So where we are here in this particular diagnostic map, we're squarely in the area of congestion at the blood level. That's what we're dealing with right now. Pelvic congestion is a congestive condition at the blood level, right? Look at the pulse is full, slippery, the tongue is swollen, wet, sublingual veins are swollen. We've seen all these already, right? And we have typical, keynote symptoms like discharges, swelling, toxicosis. We also talk about congestional damp at the mental / emotional level. This is something to consider too, actually. Although you don't always see this, but often you'll see in women and in men with pelvic congestion, you'll see tendency to repetitive thinking, worry, worrying a lot, like stuck grief or shame, which is what turns into guilt. When shame is stuck, healthy shame, which is an autonomic emotion, by the way, natural autonomic response to something that that's not right. We feel shame, and if the shame isn't resolved, it turns into guilt. Anyway, so and also we mentioned that this pelvic congestion can turn into a hot condition. So you get congestion turning into heat or having heat in addition, right? And then the pulse will become more rapid, more slippery, and so on. They tend to impulsive. Then there might be a tendency to impulsiveness, stuck anger, elation. Mood swings you'll see a lot as well. If you see both of these, you'll see mood swings for sure, almost guaranteed. Okay, and you have tongue and pulse and so on. So I want to stop there with the 6 conditions, but hopefully this can be helpful for some of you, especially interested in a east-west combo, so to speak, in a hybrid approach, east-west hybrid approach to diagnosis, which is what this is. It's a truly, I've developed this over many, many years, and this works so well. It's very intuitive, very, very intuitive. So also, I forgot to mention that the tension weakness axis is predicated on the nervous system, and the adrenal glands, nervous system, adrenal, thyroid to some extent. Okay, so this is the nervous system axis. This is the warmth system, excess, deficiency. This is the fluid system, excess, deficiency. Okay, these are the basic three systems in the body: nervous system, warmth system, fluid system. At least for diagnostic purposes, it's really helpful to think of this. Now, the eclectic practitioners and the physiomedical practitioners from the 19th century, they talked about all of these, about tense, weak, and hot, cold. Okay, in traditional Greek medicine or Tipunani medicine, the discussion is mostly around hot, cold, and dry, damp. These four. Okay, and in Ayurveda as well, it's not exclusively, but it's also weighted towards these four. I may be wrong. I'm not fully trained in Ayurveda. Anyway, it gives you maybe some historical depth to this as well. Okay, let's move on. Where are we? Okay, let's look at, okay, back to treatment. Okay, so our basic task is to promote venous and lymphatic circulation in the pelvis. Really straightforward. Nothing complicated here. So there's four essential choices in order of importance, actually. The most important herbal group of herbs that we need to consider are the pelvic or uterine and venous decongestants, right? In other words, they're herbs that decongest the pelvis and uterus and veins, the venous circulation. So they work both in the pelvic area and in the legs, okay, on the venous return circulation, all of these, okay? So we have this is simply a checklist of herbs. There's a lot of them. Let me make this a little larger, actually. Even larger. So you just have to pick and choose, So these are all Western herbs. These three are Chinese herbs. Although Bai Shao Yao, Peonia, is also being used more and more by Western practitioners, under the name of white peony root. Okay, so let's look at these. I mean, yeah, unfortunately, we don't have time to go into each one. I wish there's a lot to choose from. But I will give you an example of a formula to wrap this all up. But they're approximately in order of importance and in order of accessibility. So it's easy to get hold of yarrow, horse chestnut, lady's mantle, shepherd's perth, calendula. That's why. So HB means herb. SD means seed. FL means flower. RT is root, and so on. Okay. LF is leaf. I think it's important to specify the part of the plant that's being used, because often there's several parts of the same herb or the same plant that could be used. It just makes it clear. So those of you on the East Coast will probably love using black hawbark, cramp bark, stone root, collinsonia, right? Witch hazel, black haw. I'm going I'm going brain dead. I forgot the Latin name for these. An unusual one is red grapevine. This was used to be used a lot in the past. It grows all along the eastern seaboard. Wild red grapevine leaf. You pick the grape. They used to pick the grapevine leaves when they were red. It's a very effective herb for this condition. And then two more unusual ones: madder root and butcher's broom. Right? I've used these in the past. Butcher's broom is used a lot. Ruscus is used a lot in Europe. Madder, again, is one of these forgotten herbs that is really effective. Calendula is well known. Stoneroot is collinsonia, hamamelis, right? Calendula is marigold. It's calendula. So calendula is especially useful when a woman tends to what's called toxicosis. You know, she's accumulating toxins either because the liver is congested or because there's dysbiosis in the microbiome or microflora in the gut. So that's where calendula is very, very useful, right? These two are especially lady's mantle and shepherd's purse, capsella and alchemilla, especially useful if the bleeding tends to be heavy. Okay, and horse chestnut, aesculus, and achillea yarrow you can use anytime. These are probably the two top herbs, you know, for treating both the pelvic and the venous congestion. Okay. And then if you like to use Chinese herbs, then you have these three available: Baishao, Huaihua, and Sebaye. White peony root is widely available now. As I said, these are very, very, very effective. Huaihua, Sophora in the legume family, and Sebaye, which is called biota, although it's also called thuja. Botanically, it's a thuja. It's actually quite closely related to cypress and the Western thuja as well. Okay. So that's the first category. The next category to consider are decongestants, herbs that decongest the uterus or the pelvis specifically. In other words, they don't work on the leg, in the legs area. They simply focus on uterine congestion. In other words, another way to say that is that they are really important herbs for treating congestive dysmenorrhea. In other words, the menstrual congestion, the menstrual pathology that we see in the pelvic blood congestion. Partridge berry used to be used a lot, and I'm sure it still is. It's Michella, right? Grows in the northeast. It's throughout the northeast. Helonius root. This is semi-endangered, or it used to be. I'm not sure of the current status. This is Chemilerium, right? And I picked two herbs from the desert southwest. For those of you practicing in the southwest, red root, Cyanothus, and Ocotillo bark. Okay, these two were two of Michael Moore's favorite herbs. I studied with Michael Moore back in Santa Fe in prehistory, and so that's where I learned about these two herbs. These are powerful pelvic decongestants, but they don't work on the veins in the leg area. They focus on the pelvis and on the liver and the portal vein. Red root and Ocotillo bark. Beautiful cactus, Ocotillo. Okay. Now, when we're making a formula with these, we also want to add a small amount of arterial circulatory stimulant. In other words, we want to stimulate pelvic blood flow from the arterial end onward, if that makes any sense, right? So with the venous decongestants, we're using mostly astringents. You could get away with calling these astringent decongestants, right? Because most of them are astringent. And that, in fact, this is how they work. They astringe, and therefore they tighten, astringe and tighten in order to move the blood, right? And move the congestion. It's think of it as a very simple mechanical action. It's like squeezing a tube of toothpaste, right? With a cap open, of course, right? Okay. But these don't work that way at all. These are circulatory arterial stimulants, right? They pump, they shunt more blood into the arterial circulation and focus on in the pelvic area, right? Not so. You'll notice that I'm not using cayenne or capsicum. I'm not using prickly ash. I'm not using ginger. I'm using the ones that really have a focus or tropism for the pelvic basin. So this is another thing that's often overlooked, is the issue of tropism. In other words, what part of the body, what tissue, what organ does the herb travel to? You know, the herbs have affinities for certain organ systems, for certain tissues, certain meridians even, okay? So these ones are all amenagogues, right? They actually promote the flow, they promote the periods, the amenagogues. So we have to be careful with these, because if the period is heavy already, we won't want to use these. But if the period is simply long, then we can add a little bit at our discretion. We can add a small proportion to a formula of these stimulants. Pelvic, we could also call them pelvic stimulants. You know, that's like a short description. Pelvic stimulants: rosemary herb, juniper berry, blue cohosh root, dong quai root. This is the Chinese angelica, dangui or dong quai. Okay, blue cohosh, colophyllum. Very beautiful herb, wonderful herb, but be careful with these. Again, just use a small amount. Okay, the final first choice is lymphatic decongestants, because when the blood congests in the pelvis, then the lymph does as well. And this is what Michael Moore used to call this swampy or boggy terrain in the pelvis. Isn't that a lovely description? Swampy terrain. Anyway, so we'll want to include something, a lymphatic stimulant decongestant. Again, there's lots to choose from: echinacea, calendula, figwort. Figwort is nice. It's a scrophularia. I would use scrophularia if you're looking for an alterative as well. Alterative, in other words, a cleanser, a detoxifier. So, for example, the client may have skin rashes, chronic headaches in the morning, joint pains in the morning. You know, all typical signs of toxin retention in general. Okay, whether from liver or from this intestinal dysbiosis. So then, in that case, actually, all three of those become really relevant for that client. Echinacea, calendula, figwort. These are all alterative lymphatic decongestants, right? So we get a twofer, a two-in-one action here. That's really nice. And in women, I'm going to add another layer to this. In women, calendula has another benefit, and that is it's a hormonal balancer. No one knows how it works. People may have different ideas, but I certainly don't. It seems to balance hormones, women's hormones, in a very general and comfortable way. It's an easy, comfortable way to balance women's hormones. Can't go wrong with it. Whatever's going on with estrogen or progesterone or testosterone, calendula tends to balance things out. Maybe it works on the HPG or HPA axis, hypothalamus pituitary gonadal axis. Maybe. We don't know. I don't know any research on that. This is again the larger problem with herbal medicine is the lack of clinical research. Or especially the lack of research that's actually applicable for clinical use. You know what I mean? Because not all of it is. There's big caveats. Anyway, and again we have the southwestern pair, Cyanotus and Ocotillo, red root and Ocotillo, that work not just on they decongest the liver, they decongest the and both blood and lymph in the pelvis as well. So I see one question: would arterial stimulation increase related stress on the blood level? Not necessarily. No, if used in a small amount, then so let's give it then, and if there's no heavy periods, then they're helpful, because the arterial stimulation then helps the venous push as well, the venous astringent mobilization. Does that make sense? I see another. I'll just take these as they're popping up. I might as well. Can pelvic congestion be linked to IBS, irritable bowel syndrome? Well, I mean, ultimately, anything can be linked to anything, but not. I wouldn't say immediately. Not immediately, but to some extent, yes. I would say medium, moderately. There's not a quick link there, as there is to the other big three that we looked at, but it's something certainly to consider, definitely, especially if you have, just take and look at the whole symptom picture. Treat what you see, basically. Okay. Formula. So I'll just give you a typical formula. This is, to give it just for an example. So let's take 2 parts horse chestnut. I'm happy to type it up in chat if you need to, but I don't think, I probably don't need to. 2 parts, so horse chestnut, 2 parts black haw or cramp bark, take your pick. These treat both congestive and spasmodic dysmenorrhea. So you're covered with menstrual cramps and menstrual problems. This covers, both of these cover a lot of area. So horse chestnut, black haw, or cramp bark, 2 parts. Calendula, 2 parts. Calendula, 2 parts. Juniper berry, or any other one of these, 1 part. 1 part of stimulant, and calendula. We also have. I'm sorry, I forgot to mention 2 parts calendula as well. So let me summarize again: 2 horse chestnut, 2 black haw or cramp bark, 2 calendula, 1 juniper berry, 1 licorice. Licorice to smooth out the whole formula. Okay, that's it. So instead of calendula, you could use figwort or echinacea, etc. You could substitute. Now you get the idea. you could possibly substitute and many of these others, right? Okay. There's a question is on it here, which is yes, usually hot flashes are related to estrogen surges. Yeah. So that's, but as I said, they don't hot flashes is not a primary symptom with pelvic congestion, not at all. And you can have signs of heat. The person can have a red tongue, you know, kind of signs of heat without hot flashes, right? So you can have a condition of pelvic blood congestion with heat and no hot flashes at all, and nothing to do with estrogen retention at all. Okay. So let's look at other miscellaneous measures. Lymphatic drainage massage in the abdomen can be very helpful. Also massage from the feet up the legs to the torso to encourage the venous return, right? This is especially useful in the case of venous insufficiency, right? We massage up the legs. By the way, this is very sedating or calming to the heart and the nervous system. So if you don't be surprised if the person falls asleep on your massage table. Okay, just heads up. Now you can add, if you want to, you can add essential oils to the massage, to the basic massage oil. So then I would use a high dilution, highly diluted medicated oil. The dilution percentage is only 1 to 2%, which means 1 to 2% of these essential oils to 98 or 99% vegetable carrier oil. Are you with me? So that means, so a 1% dilution is 9 drops per 1 ounce or 30 ml of vegetable carrier oil. So this gives you the ratio, right? If you're doing, you could also do a liniment. A liniment is the same. It's basically, again, an essential oil dilution in a vegetable carrier oil, or it could be a herbal tincture dilution, like capsicum, whatever, in a vegetable carrier oil. But for a liniment, we use a stronger dilution. I would use the stronger dilution. You can go 2 to 3%. Okay, and then the essential oils are all in italics. So on the lower abdomen, you can do liniment, lower ab liniment with cedarwood or cypress, or and basically any combination of these, any single, any one, or any combination is fine. And this list, these oils are all lymphatic stimulants, right? The stimulants meaning they decongest the lymphatic circulation. Lemon, lemongrass, grapefruit. But do not use them undiluted. Please, please. Topically, the essential oils always need to be diluted. These are the correct dilution percentages. Please treat the essential oils with respect. There's so much nonsense being talked about, you know, by the multi-level essential oil companies. You know who they are. Forget about all that. You know, we're talking about clinical use here. We're not talking about anything else. You know, welcome to the age of online, right? Moving on, gentle rebounding is really helpful. You know, using a rebounder. They used to be popular in the 90s, but I think they're coming back. Rebounders are really helpful. 5 or 10 minutes every day is great for lymphatic circulation. Belly dancing, recumbent bicycling, right? Swimming, walking, cold sitz baths, short cold sitz baths, just a minute or two is all you need. Yoga shoulder stand, headstand, morning and evening. This really helps with flow away from the pelvis and up to the rest of the body, especially the head. Both of these are very helpful for low thyroid functioning as well. They increase thyroid and pituitary functions as well. Okay, deep breathing involving the diaphragm. Deep breathing is belly breathing, right? Involving the belly. Usually inhale while you're expanding the belly. The second half of the inhale opens the chest, and then you do the opposite on the exhale. Okay. There's also Ujjayi or Qigong breathing specifically. These are very helpful. The diaphragm is one of the blocks, right? One of the three main blocks in the body. The one we're talking about now actually is the pelvic block. You know, the lower chakra, you could call it the lower chakra block. Pelvic block, diaphragm block, throat block. These are the three energetic blocks that that prevent circulation of blood and energy through the block, through those parts of the body. Anyway. Another, sleeping with the lower end of the bed higher than the head to encourage venous return, to encourage the venous circulation to return back up to the heart. This is a very simple, practical thing to do as well. Okay? I see a few questions. I don't mind taking, one of them relates to the formula, so I should look at that one. So, Jacqueline, you have a question. Should we try this formula before cramping begin or during the onset of menstrual cramps? I would start before. This is a formula for throughout the cycle. You know, because we disregarding any coexisting condition, it's designed for the whole cycle. Okay. Another question is there a herb to tackle estrogen dominance? Well, there's several parts to that answer. First of all, this is estrogen accumulation doesn't always translate into estrogen dominance. You know, there's a difference between a blood test, you know, a blood reading, the levels of the hormonal levels in a blood test, the blood test results, and what is actually happening inside the cell. So you have to be super careful. This is why I do not call. This is why there is a difference. There's a difference between estrogen dominance, which is actually, it's a blood test diagnosis. That's all it is. But it does not equate across the board with estrogen accumulation, which you can also call estrogen retention, right? That's the clinical syndrome that we see, estrogen accumulating, becoming toxic in the body. Okay? It may or may not relate to estrogen dominance as in terms of a blood test. Okay? So this is where a lot of people trip up, you know, confusing those two. Second part to that, to your question, Jacqueline, is yes, there are many herbs to tackle estrogen. Well, if we're talking about excessive estrogen in the system, you know, being recycled in the system and not being eliminated, yes, there are quite a few. The main one in terms of our discussion is actually calendula, marigold, because it's a hormonal balancer. So I would focus on calendula and echinacea, using alternatives first and foremost to get rid of the toxic estrogen. Also, make sure treat the liver, treat the microbiome dysbiosis. Almost always with estrogen retention, the microbiome or the intestinal flora is dysbiotic. That means that toxins are being produced and retained, including estrogen, and being recycled in the system, right? So those are the two areas to work on: the liver, detoxify and decongest the liver, which we're going to look at in the next, actually, and also clean up the intestinal microbiome dysbiosis or microflora dysbiosis with prebiotic foods, probiotic foods, supplements, etc., etc. Whole other discussion. Love to do it one day. Okay. How long? Arlene has another question about the formula. Okay, we're still on the formula. How long should one take this formula of herbs? Well, ideally, until you see a cure. You'll see improvements, but depends how you're working with herbs. I mean, in an ideal world, we modify the formula every few weeks, couple of weeks or so, to keep up with a changing condition. The more as things improve, we take out some herbs, we add some others, make the formula more tailored to the specific condition, to the client or patient. Yeah, calendula or marigold is the general hormonal balancer for women. It's not super strong, but it works. It adds a nice icing to the cake, so to speak, when you're treating something else in women. I'm watching this. Okay. Okay, Victoria, hang in there. Appreciate your message, Victoria. Hang in there. Let's move on a little bit. Strengthen the capillaries. So often, this is almost an afterthought, actually. So, but in women where you see a constitutional, hereditary weakness of the veins, then capillary tonics are very useful. Witch hazel, etc., etc. Bilberry, I love this one. Bilberry, vaccinium, which is not blueberry, by the way, different, not blueberry, bilberry, leaf and fruit. Okay? Supplementation can be helpful. Bioflavonoids, especially parenthocyanidins in red berries. These are coming into season now. Eat your blueberries, right? Promote blood vessel integrity, right? The stronger they are, the more they can resist the blood from congestion. Pycnogenol has extract up to 300 milligrams a day. Vitamin C, either as a separate powder or red fruit, ideally in red fruits or powders. Mixed tocopherols, vitamin E to improve blood flow. If there's excessive bleeding, we might think of vitamin K, okay? And then collagen protein as well. Okay, not just for skincare, beauty care, but also for the tissues in general, connective tissue. Connective tissue is extremely important for everything. Very important. Okay, and the third, two more. Decongest the liver and portal vein. This is another consideration. I just took some of the heavy hitters for the liver. Liver decongestants and detoxicants. Dandelion, artichoke, turmeric, curcuma. Celandine, one of my favorites. Chelidonium. Maybe harder to get, I'm not sure. On the East Coast, you have bugbean, fringe tree, butternut, juglans, geonanthus. This is a beautiful tree. I saw this in a botanical garden in Pennsylvania, actually, in Philadelphia. Beautiful tree. Bog bean, other places too. Bog bean, Meniantes. These are really good. So try to use local herbs if possible. Wherever you live, there's many reasons why you should favor using local plants rather than others. I know it's hard to do. It's difficult, but it's something that we do strive for in general. Okay. Liver-friendly diet. In a nutshell, eliminate bad fats. No fried foods. Red meat. No red meat. White meat is okay. Chicken and so on is not okay generally. No drugs, no alcohol, etc. Focus on steamed greens, lightly steamed. Salads are good too. Greens, vegetables. Another benefit of greens, of course, that they open up the nitric acid pathway chemically in the body. Nitric acid is huge in the body. There's more and more research on that. Almost every week, someone's coming out with research on this. Nitric oxide is, nitric acid, nitric oxide. This is a chemical pathway that is beneficial to almost every process in the body, everything in the body. And green vegetables are key for inducing the nitric oxide pathway, right? So, and another vegetable that's really important for this is beetroots. So now, you can actually buy beetroot powder. Beetroot powder is available. It works. It's very simple. It should be 100% pure powdered beetroots. Nothing added, nothing taken away. If it's organic, that would be super helpful, of course. And beetroots are powerful, very powerful. Cooking oil, vegetable oils, coconut and olive oil, I highly recommend. But olive oil should always be used fresh. You should never heat up olive oil, because the smoking point of olive oil is really low. So the point at which it starts to create free radicals in the body, it becomes oxidizing, increases oxidation in the body, which is not a good thing, is rather quickly. So olive oil should, as far as I can tell, should always be used fresh. I mean, warmed up slightly warm is okay. Room temperature is perfectly fine. Like sprinkled onto veggies, salads, grains, and so on. For cooking, I rely almost exclusively on coconut oil. Expeller pressed coconut oil. It doesn't even have to be organic, as long as it's expeller pressed and not processed. This is important. I know it's cooling. Well, it's not super cooling. Warming, the fact that we're warming it cancels its cooling effect to a large extent already. So if you're worried about that, then an alternative is red palm oil, right? However, there's serious environmental considerations associated with red palm oil that they're not good. Those palm trees are added to our, they used to deforest, for deforestation of tropical zones. For example, especially in Borneo, countries like South America, Borneo, not good news at all. So I try to stick to coconut oil. Again, I don't think it's really cold. I think it's neutral. Okay, I have my scale of the warmth effect. I talk about the warmth effect of herbs and oils and foods. So coconut I classify as neutral to cool. So if someone has a hot condition, if someone tends to heat more to pitta or hot condition, then coconut oil can act rather cooling. if someone is balanced, then especially if you're warming it up anyway, then it's not going to be cooling. It's not going to have I don't think it has a cold effect. Ghee is wonderful. Ghee is neutral. It treats all three dosha. You can't go wrong with ghee. Yeah, absolutely. Avocado oil, I'm not that familiar with. Don't work. I keep avocado for skincare, to be honest. Yeah, it's a beautiful oil. Like a bit like, well, it's pretty unique. It's good. Yeah, it's a good oil. Anyway, so castor oil compresses or liniments over the liver are very good for helping the liver decongest and detoxify as well. So here we can use, if you want to use, you can use just castor oil on its own in a cold compress or warm, let's say warm compress. Be sure to use the Edgar Cayce castor oil, right? Not, organic if possible. Organic cotton cloth and so on. If you're making a liniment, in other words, you're using a vegetable carrier oil, then the dilution percentage is again low, 2 to 3% of essential oil diluted in 97 or 8% of carrier oil. So then, and the carrier oil can be, we like to use a highly absorbent carrier oil like apricot kernel. Apricot kernel or grapeseed, organic grapeseed is pretty good. Or you can make a blend of sweet almond, equal parts sweet almond, apricot, and so on. That works really well. And then you can also put a cloth over it, compress over it as well, to promote absorption. The idea is that the essential oils will absorb into the liver organ directly, right? Okay, which it will do to some extent. Okay, it actually works in two ways. It works partly by a certain amount of physiological absorption and a certain amount by reflex activity, reflex action, right? Because all the skin is one big reflex zone, not just the hands, the feet, the ears, and so on. Actually, the whole skin. So these are the oils that help detoxify and decongest the liver organ: geranium, tropical, basil, lemon, and rosemary. Okay. So you could add, again, just either any one or combination of these will work. I've used very safe ones. You can't go wrong with any of these. Okay. And then lastly, we need to treat the underlying, if present, we need to treat any underlying endocrine imbalance, especially the estrogen toxicosis, possibly progesterone deficiency. This is another less likely underlying pattern that you might see, hormonal pattern that you might see associated, deficient progesterone. But as I said, the main one is estrogen accumulation, which I also call estrogen toxicosis, because that's like literally what happens. The estrogen, as it's retained in the tissues, it becomes pretty toxic. And that's what causes the hypersensitized system. Everything is hypersensitized, right? Especially in those areas where estrogen is retained, for example, the breasts. Right? So, this is basically it. Let's look at, I'm going to close up with looking at any questions, any more questions. Keeping things cold. That's right. Yeah. Mm-hmm. Okay. Okay. Amrita has a question. Which compress is better, cold or warm, for liver decongestion? Actually, because the liver, That's a really subtle clinical question. The truthful answer is it depends on the condition of the liver. Now, if you can, the liver organ is as a tissue is actually a big bag. Sorry, it's a bag of hot blood, right? The temperature of every organ has an internal temperature, and the liver is actually the second most hot condition organ in the body. The most hot are the kidneys. The liver organ is the second hottest, so it's already hot. So if there's any possibility of the liver becoming more warm, forget it. Then just use a neutral room temperature compress, and that's the best. To be safe, just use it at room temperature. Cold is okay if the liver is tending to heat, if there's any sign of heat. Okay. Great question. Do you have favorite methods for increasing progesterone? Oh, yeah. Well, yeah, of course. White peony root is wonderful. Coriander seed, just off the top of my head. Wild yam root. The main ones I use are coriander seed and white peony root for increasing progesterone. There's also saw palmetto, which is serenoa. Okay. But again, you need to look up the dosage. Get hold of a book that actually spells out the dosage. You need to get hold of a good tincture, a good quality tincture. You know, many tinctures in this country that, as I'm sure many of you know, that are publicly available in the stores are leave a lot to be desired. Okay, leave a lot to be desired. So you need to be working with either making your own tinctures or get use a reliable tincture company that makes clinical quality tinctures. Yeah. And by the way, I like the tincture preparation as in terms of a delivery method or preparation. I advocate tinctures more than anything. They work really well because you've got the combination of alcohol and water, which extracts the maximum from the plant. As long as you get the water alcohol ratio right, you've got to look up the correct alcohol ethanol ratio, right? So you'll find that, for example, in my book, The Energetics of Western Herbs. It's all in there. It's a really nifty reference book, if I say so myself, and it's all about clinical information and dosing and posology and so on. Okay. Okay. Victoria has a message, but it's a private message, so I'll skip that for now. Does anyone have a public question in chat, or you can go live if you want to? I'm going to turn on my speaker again. My speaker keeps blinking out after a while. Okay, so if you have any more questions, can you speak them out? Can you turn on your you can turn on your gallery view and actually speak your question. No, sorry. If you ask a question, can you turn on your video? So it really helps me understand the question if I can see you. So Tanya, do you want to pose your question live? Mm-hmm.
Hi, I'm sorry. I can't get the video on. I was just asking about soy products in the diet and how that affects estrogen and some of these conditions that we're talking about today.
That's yeah, it's quite a long discussion, but the main foods I would avoid are cabbage family foods and raw soy. No raw soy products like soy milk, raw tofu, nothing like that, and no raw cabbage. Fermented cabbage, like sauerkraut, may be okay, but otherwise, that's the main dietary advice.
Thank you very much.
Yeah. Okay. Any other live questions? Food is medicine. Food is medicine. Yes, indeed. So yeah, for long-term treatment, you have to include the diet. Can't get around that. Okay, well, thank you again so much for joining me today, this afternoon, this evening, and I look forward to possibly seeing you at future workshops. Okay, so carry on the good work. I really hope it's been helpful. And I'm going to pass it over to you, John, again.
Yes, yes, thank you, Peter. This has been very helpful. This has been great, and I really appreciate you offering this to the American Association of Biocharacteristics Clinicians. It is helpful for everyone to continue learning, and that cross-pollination. A lot of people on the call are from the Ayurveda background, and so they are having them get that cross-pollination and introduction to some of the TCM terms, and even just seeing how just the approach that may be slightly different from the Ayurvedic approach is, I think, very helpful, very enlightening, and important for people's growth. That's part of the mission of AABC, is to bring together these different medical systems, Greek medicine, Unani Tib, Chinese medicine, Ayurveda, that are using a biocharacteristic style of analysis, and have had wonderful, innovations, all those three systems. And so just having you here today, knowing that you have studied Western herbalism, and I know from reading the book, The Energetics of Western Herbs, which is a fascinating book, that you're integrating Greek medicine and have extensive knowledge of more ancient Western herbal texts that were based on that model. And so it's been very great to have you here today. I really appreciate it. I learned a lot from you, and I'm sure everyone else can say the same. Yeah, so thank you. And great. So I'll announce future workshops. We'll be doing a workshop on varicose veins coming up, which has some similarity to today's talk. As you can see, that varicose veins are also a blood congestive disorder of the lower warmer. You said in Ayurveda, I don't know if we have a term for lower warmer that's an exact equivalent. But there's some similarity there, and look forward to talking about that, and look forward to having you again, Peter. Yeah, so thank you, everyone, and we will hopefully see you soon. Take care.
Okay. Thanks again, John. Thank you, everyone. Thank you.
Take care.
Bye-bye. Bye.